I know we all miss the green. We're all a little lost with that, without that green. So it's coming back. Committees will come to order, and the chair, we did the opening statements yesterday, and anyone that would still like to put an opening statement into the record without objection, so ordered. But the chair at this point will call up H.R. 2566 and ask the clerk to report.
H.R. 2566, to amend the Communications Act of 1934 to ensure the integrity of voice communications and to prevent unjust or unreasonable discrimination among areas of the United States and in the delivery of such communications.
And without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments? Are there any amendments? Seeing none, the question now occurs on favorably reporting H.R. 2566 to the House. All those in favor shall signify by saying aye. Aye. All those opposed say no. Opinion of the chair, the ayes have it, and the bill is favorably reported. The chair would now call up H.R. 2669 and ask the clerk to report.
H.R. 2669, to amend the Communications Act of 1934 to expand and clarify the prohibition of provisions of inaccurate caller identification information and for other purposes.
And without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Chair would recognize Mr. Walden.
Thank you very much,
for the
Mr.
purpose
Chair.
of offering an amendment in the nature of a substitute.
Correct. I believe it's at the
Clerk-
desk, probably
clerk-
under Barton.
Clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 2669, offered by Mr. Barton.
And by Mr. Walden. And without objection, the reading of the amendment is dispensed with, and the gentleman is recognized for 5 minutes in support of the amendment.
I won't take 5 minutes, Mr. Chairman. This is a bipartisan amendment. It makes some changes to conform to the Senate language so we can move forward. It makes some technical changes in the definitions of text messaging. I really want to thank my colleagues on the other side of the aisle. We all worked together on both of these bills. I think everybody's on the same page on this amendment in the nature of substitute so that this can move rapidly to the President. And so with that, Mr. Chairman, I would urge support of our colleagues and yield back.
Gentleman yields back. Other members wishing to speak on the amendment? Seeing none, the vote occurs on the amendment offered by the gentleman from Oregon. All those in favor say aye. Aye. Those opposed say no. Opinion of the chair, the ayes have it. The amendment is adopted. Is there further amendments to the bill? Seeing none, the vote now occurs on the bill favorably reporting H.R. 2669 is amended to the House. All those in favor shall say aye. Aye. Those opposed say no. Opinion of the chair, the ayes have it, and the bill is favorably reported. The chair will now call up H.R. 1192 and ask the clerk to report.
H.R. 1192, to amend the Public Health Service Act to foster more effective implementations and coordinations of clinical care for people with prediabetes, diabetes, and the chronic diseases and conditions that result from diabetes.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendments at any point. Are there any bipartisan amendments to the bill? Are there any amendments to the bill? If not, the question now occurs on favorably reporting H.R. 1192 to the House. All those in favor shall say aye. Aye. Those opposed say no. Opinion of the chair, the ayes have it, and the bill is favorably reported. Chair will now call up H.R. 1209 and ask the clerk to report.
H.R. 1209, to amend the Public Health Service Act to provide for the designation of maternity care health professionals shortage areas.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Chair would recognize Dr. Burgess for the purpose of offering an amendment in the nature of a substitute.
Thank you, Mr. Chairman. There is an amendment in the nature of a substitute, which is basically technical changes to the language of the bill that was passed by the subcommittee. This has been worked out with both sides, and I would urge passage of the bipartisan amendment in the nature of a substitute.
Clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 1209, offered by Mr. Burgess.
And without objection, the reading of the amendment is dispensed with. Gentleman has been recognized and has concluded. Are there amendments to the amendment in the nature of a substitute? Dr. Burgess, do you have Dr. Burgess has an amendment to his own amendment.
Amendment to the amendment of the nature of a substitute.
Clerk will report that title of that amendment.
Amendment to the amendment to the amendment in the nature of a substitute to H.R. 1209, offered by Mr. Burgess and Mrs. Capps.
Without objection, that amendment is read. And further discussion? Seeing none, the vote occurs on the amendment to the amendment in the nature of a substitute. All those in favor will say aye. Aye. Those who say no, amendment is adopted. Vote now. Are there further amendments to the amendment in the nature of a substitute? Seeing none, the vote now occurs on the amendment in the nature of a substitute to the bill. Although, as amended, those in favor will say aye. Aye. Those opposed say no. Can you share that is adopted? Are there further amendments? Seeing none, the vote now occurs on the amendment in the nature of a on the bill as amended. H.R. 1209, those in favor shall say aye. Aye. Those opposed say no. Ayes have it, and the bill is favorably reported. Chair now calls up H.R. 1877 and asks the clerk to report.
H.R. 1877, to amend Section 520J of the Public Health Service Act to authorize grants for mental health first training programs.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments?
Mr. Chairman, I have an
Lady
amendment at the
from
desk.
California? Yes. Has an amendment at the desk?
Yes.
And the clerk will report the title of the amendment.
Amendment to H.R. 1877, offered by Ms. Matsui.
And without objection, the amendment will be considered as read, and the gentlelady is recognized for 5 minutes in support of her amendment.
Thank you, Mr. Chairman. This is a technical amendment to H.R. 1877, the Mental Health First Aid Act, that the Health Subcommittee reported out last week. Too often, tragedies occur when they could have been prevented. We need to ensure that our law enforcement officers are equipped with the training they need to adequately respond to and assist people in distress. The Mental Health First Aid Act would help first responders come to the aid of someone who's struggling with a mental illness or substance use disorder, so that the use of force is a last resort. Passing this bill today is another step forward in our overall mental health reform efforts. Mental health first aid programs across the country, including in Sacramento, are helping to reduce stigma and promote awareness. There is still much more to do in our efforts to advance comprehensive mental health reform, from addressing our behavioral health workforce shortage to ensuring parity between mental and physical health. I want to express my thanks to Congresswoman Jenkins for her work on this issue, and to the Chairman and Ranking Member for supporting this important legislation. Mr. Chairman, I would like to ask unanimous consent to submit 3 documents for the record: a letter of support from the Catholic Health Association, and 2 articles highlighting the effective use of mental health first aid in prisons and law enforcement.
Without objection.
Thank you, and I yield back.
Gentlelady yields back. Other members wishing to speak on the amendment? Seeing none, the vote occurs on the amendment offered by the gentlelady from California. All those in favor will say aye. Aye. Opposed say no. Opinion share, the ayes have it. Further amendments to the bill? Seeing none, the question now occurs on favorably reporting H.R. 1877 as amended to the House. All those in favor shall signify by saying aye. Aye. Those opposed say no. The ayes have it, and the bill is favorably reported. Chair now calls up H.R. 2713 and asks the clerk to report.
H.R. 2713, to amend Title VIII of the Public Health Service Act to extend advanced education nursing grants to support clinical nurse specialist programs and for other purposes.
And without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments to the bill? Any amendments to the bill? Seeing none. Oh, Ms. Capps would like to strike the last word?
I just want to state that I do have an amendment at the desk.
Oh, I'm sorry. Gentlelady has an amendment at the desk. The clerk? No? There is no amendment at the desk. There is.
It just arrived, and all I need to say is that it's technical changes, and I urge support for the amendment.
Let the clerk report the title of the amendment.
Amendment to H.R. 2713, offered by Ms. Capps.
And without objection, that technical amendment is considered as read. Gentlelady yields back her time in support of that amendment. The vote occurs on her amendment. Those in favor will say aye. Aye. Those opposed say no. In opinion share, the ayes have it. Are there further amendments to the bill? Seeing none, the question now occurs on favorably reporting H.R. 2713 as amended to the House. All those in favor shall signify by saying aye. Aye. All those opposed say no. Ayes appear to have it. They have it, and the bill is favorably reported. Chair now calls up H.R. 3537 and asks the clerk to report.
H.R. 3537, to amend the Controlled Substances Act to clarify how controlled substance analogs are to be regulated and for other purposes.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Chair will recognize Mr. Pitts for the purpose of offering an amendment in the nature of a substitute.
Thank you.
First, the clerk will report the title,
Amendment in the nature of a substitute to H.R. 3537, offered by Mr. Pitts.
and the gentleman is recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chairman. This is a bipartisan amendment. This substitute amendment, in the nature of a substitute, would add 22 dangerous synthetic drug compounds to Schedule 1 of the Controlled Substances Act. It strengthens the Drug Enforcement Administration's ability to take swift action against individuals peddling such drugs in communities across our country. And I'd like to thank Representatives Dent and Katko for their leadership on this issue. Urge my colleagues to support the amendment and the bill, and with that, I yield back.
Gentleman yields back. Chair to recognize gentleman from New Jersey to speak in support of the amendment in the nature of a substitute.
Thank you, Mr. Chairman. I move to strike the last word. The amendment before us today takes a narrow, targeted approach to addressing the latest threat from synthetic substances. The evolving synthetic drug market has led to widespread overdoses and deaths among both adults and teens. We're all aware of instances in our communities where constituents utilizing synthetic substances as a way to imitate the highs of other substances such as marijuana, heroin, or opioids have either harmed themselves or others. And these drugs are extremely unsafe and can cause convulsions, anxiety attacks, hallucinations, psychotic episodes, and in some instances, death. These substances are unfortunately not illegal and as a result are too readily available. Under its current authority, the Drug Enforcement Agency has difficulty taking action against these substances, and manufacturers of these synthetic substances have been able to avoid regulation under the Controlled Substances Act by swiftly engineering and re-engineering these substances in ways to circumvent regulation. The aims to H.R. 3537 would schedule a narrow list of 22 synthetic substances, including 11 used to create synthetic marijuana and 3 derivatives of fentanyl, a synthetic opioid that is more powerful than morphine. This targeted legislation was developed with input from DEA, the Department of Health and Human Services, the National Institute on Drug Abuse, and the Office of National Drug Control Policy to ensure that the substances we're legislatively scheduling to Schedule 1 because of abuse potential have no therapeutic value. And I believe this legislation will take the needed step of helping DEA take appropriate enforcement actions to prevent access to these dangerous substances. So while this legislation does address the broader concerns that have been raised related to access to Schedule I substances for research purposes, I'm committed to continue to work with my colleagues on the other side of the aisle, the administration, and stakeholders to find ways we can streamline the registration process for legitimate research purposes. And so I urge my colleagues to support the aims, and I look forward to continuing to work with my colleagues to reduce the availability of dangerous synthetic substances. I yield back.
Gentleman yields back. Other members wishing to speak on the amendment in the nature of a substitute? Seeing none, the vote occurs on that amendment. Those in favor will say aye. Aye. Those opposed say no. Opinion chair, the ayes have it. The amendment in the nature of a substitute is adopted. Are there further amendments to the bill? Seeing none, the vote now occurs on H.R. 3537 as amended. All those in favor will say aye. Aye. Those opposed say no. The ayes appear to have it. The ayes have it, and the bill is favorably reported. Chair now calls up H.R. 4365 and asks the clerk to report.
H.R. 4365, to amend the Controlled Substances Act with regard to a provision of emergency medical services.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Chair would recognize Mr. Hudson for offering an amendment.
Thank you, Mr. Chairman.
Go report the title of the amendment.
Amendment in the nature of a substitute to H.R. 4365, offered by Mr. Hudson.
And without objection, the reading of the amendment is dispensed with. The gentleman is recognized for 5 minutes in support of his amendment.
I thank the chairman and want to thank my partner on this bill, Mr. Butterfield, and his staff
as well as Chairman Upton and his staff, and Ranking Member Pallone and his staff for their hard work in getting to this consensus. This has been a real bipartisan team effort, and I'm very proud of what we've accomplished. In that spirit, I have letters of support from 17 organizations, including the National Association of EMS Physicians, the American College of Emergency Physicians, the American Hospital Association, the National Association of EMTs, the International Association of Fire Chiefs, and the International Association of Firefighters that I would ask unanimous consent to submit for the record. It's important that we acknowledge the impact of the Protecting Patients' Access to Emergency Medications Act will have on the safety and well-being of all Americans. This bill will codify a new system of registration for EMS agencies under the Controlled Substance Act so that our first responders can continue to deliver the most appropriate and timely care to patients. Again, I want to thank all of my partners in this effort who helped make this legislation possible. And Mr. Chairman, I yield back.
Gentleman yields back. Chair would recognize the gentleman from New Jersey to speak in support of the amendment.
Mr. Chairman, I support the amendment, and I just wanted to submit my statement of support for the record. I ask unanimous consent.
Without objection, the statement is included as part of the record. And are there other members wishing to speak? Seeing none, the vote occurs on the amendment offered by, in the nature of a substitute, offered by Mr. Hudson. All those in favor will say aye. Aye. Those opposed say no. Opinion chair, the ayes have it. The amendment in the nature of a substitute is adopted. Are there further amendments to the bill? Seeing none, the vote now occurs on H.R. 4365 as amended. All those in favor shall say aye. Aye. Those opposed say no. Opinion chair, the ayes have it. The amendment in the nature of a substitute is agreed, is adopted. The bill is favorably reported. So that concludes our business. Without objection, staff is authorized to make technical and conforming changes to the legislation approved by the committee today. So ordered, and without objection, the committee stands adjourned.